Well, it's a decision no one wants to make, to put a loved one into a nursing home. There are plenty of licensed nursing homes here in Florida, but not all of them provide the same level of care. I-Team investigator Adam Walser has been digging into the issue and offers some advice on checking out facilities before it's too late.
What does your wife mean to you?
Everything. We had a perfect marriage.
Larry Greenberg and his late wife Judy spent 52 years together, from the time they met as young teachers to their retirement in Pasco County, where they rescued animals and enjoyed long walks.
And now I'm lost. And that's it. Nobody can replace her.
Judy's life changed forever last year when she was sent to Consulate Healthcare of Bayonet Point for rehab after a hip replacement.
They took a perfect woman and ruined her life, her retirement, and everything we worked for.
Larry's now suing the nursing home for negligence, claiming Judy suffered loss of dignity, humiliation, and bodily injury there. He claims the overworked nursing staff at the facility often was delayed when she asked for assistance going to the restroom. Larry told police when help was delayed one day, Judy tried to go to the bathroom by herself, fell, and broke her leg.
So now she's bedridden, and that started the downhill spiral.
It's constant.
Attorney Jim Wilkes has been battling nursing homes for years.
I mean, we've seen people wander off literally and be eaten by alligators in ponds in the back of the nursing home from lack of staffing.
This free Medicare-operated website, Nursing Home Compare, allows people to check out nursing homes before putting a loved one there. It tracks data like staffing hours, where Consulate of Bayonet Point ranks below average because nursing staff hours per resident per day there is about 25% below state and national averages. You can also find inspection reports like this one from 6 months after Judy's fall, where Consulate at Bayonet Point was cited for failing to follow a fall prevention plan for multiple patients. Judy had already passed away by then. While the medical examiner originally listed the cause of death as heart failure,
he looked over all the records, and he said, "We're changing your wife's death certificate from natural causes to blunt trauma. If she hadn't fallen and broken her leg, everything else that followed would have never happened."
Consulate of Bayonet Point says it can't comment on pending litigation, but says the facility has good ratings and has won awards. The home also fares well when it comes to the use of antipsychotic medication, another thing tracked on Nursing Home Compare. Since February, the site has tracked the number of long-term patients who receive antipsychotic medicine, drugs intended to treat serious mental illnesses like schizophrenia and bipolar disorder. Those drugs are not approved for treatment of elderly dementia patients and even carry a black box warning saying they can increase the risk of death. Yet 21% of Florida nursing home patients are prescribed antipsychotic drugs. Some nursing homes have rates that are much higher. We're seeing rates of 40, 65% in some cases.
Yes. What you see is oversedation.
This 2014 report from the Department of Health and Human Services says 83% of patients given the drugs don't have a condition for which it has been approved. Instead, it says facilities use them as chemical restraints to control behaviors like wandering, crying, or resisting care.
It actually increased the costs at a level that's exponential. The people get sick, they fall, they become incontinent, they get bed sores, they end up in and out of hospitals.
The I-Team has uncovered at least 25 Bay Area nursing homes have antipsychotic drug prescribing rates of more than 30%. But the leader by far in the Bay Area was Jacaranda Manor, where government statistics show 64.6%, or nearly 2/3 of patients, are prescribed antipsychotic medication. Jacaranda Manor received the lowest possible overall rating of much below average on Nursing Home Compare, but the company says that rating doesn't accurately reflect the care and services provided. The company says the home accepts patients with psychiatric behavioral issues that other nursing homes have refused to care for due to their diagnoses. Medicare hopes that by giving more information to consumers, they can better choose care providers for their loved ones, something that's never been more important.
Baby boomers are getting into that frail elder stage. We'll triple the number of beds in the next 15 years.
I'm I-Team investigator Adam Walser, taking action for you.
And we have the full statement from Jacaranda Manor posted on our website at abcactionnews.com. There we also posted a map showing the top 25 nursing homes in the Bay Area when it comes to prescribing those antipsychotic drugs, along with a link connecting you to the nursing home's website.